physician at Medicover Hospitals, Visakhapatnam, and I head the department over here. We are a multi-specialty hospital at Visakhapatnam. We have two branches. One is a multi-special hospital with neurosurgery, neurophysician departments. At the same time, we have cardiology department and also general physician. The other department is dedicated for mother and child. That's the unit one, and we deal with the multi-specialty hospitals. Along with that one, I do run a course for the emergency medicine department. We have students, residents who are doing their 1-year diploma course, and they will be rotated in the departments at the same time in the emergency department also. Today I'm going to talk a little bit about coronavirus. I know people have been fed up with the word corona from the last 5 months. So this is for the common man. I'll not go deep into the subject, but I will go in such a way that the common man also can understand. And if you have any doubts, you can ask me in the chat window at the end. Okay, let us start the presentation. Yeah, coming to the virus about itself. So, as a common man, we don't need to know much about the virus and its details. But what we should and must know is that by what it is killed. As you know, the outer layer of the virus is made up of a fatty layers. It has got many layers and many particles. So, what as a common man we are interested in is the outer layer. See, as it consists of fatty layer, you might have heard in the news and in the WhatsApp messages that we need to wash our hands regularly. The reason why they are asking us to do is that the coronavirus, the outer layer is made up of fatty layer. So as you start washing your hands with a soap for almost 20 seconds, or with probably with alcohol based 70% alcohol based solution. So what happens is this kills the outer layer of the outer fatty layer of the virus, so that the virus is killed and it will not be able to replicate. So that's the main reason why we are asked to wash our hands regularly at regular intervals and with 70% of alcohol. Okay, and the next point may be related to the medical people a little bit. See, the envelope is consisted of glycoprotein projections. So what is its importance? If you see, the virus carries the antigenic epitomes on that one. So as a common one, what you people should be knowing is that we are seeing this cold or flu yearly and yearly. More and more people are affected. So it is the regular virus only. Whatever the virus you are seeing this year, the same virus is infecting the next year also. So how is it happening? It is because of this antigenic shift and antigenic drift, with which the virus change their structure so that they can infect again and again and again over years and years. So the newly found coronavirus, see, actually it's not a newly found coronavirus. It is there in our body from long back, but only that it has become a genetically modified one and it has become more virulent nowadays. So using these genetic shifts and their drifts, the coronavirus also is changing its shapes and infecting more and more number of people and becoming more virulent. So a little bit about the genome size. So it is of 26 to 32 kilobase. Again, if you see, we don't need to know much about the size. But why I'm mentioning this one is that because of its large size, what happens is that luckily it is not airborne. So it may travel to a little bit distance, but because of its high size, it falls down on the surface so that it is not spread to a longer distance. Think that if the size is less, like 2 kilobases or 1 kilobase, what happens is once the aerosols or the droplets dry up, it can go into the air and can travel a long distance. So luckily, because of its size, it may not be able to travel a long distance. So coming to the epidemiology, if you see, usually one will get flu more commonly in the winter season. It's not like that one won't get cold in summer seasons, but the commonly it occurs in winter. Usually the series lasts for a few months to few weeks, And remember, as I told, the virus can change its strands with antigenic shift and drift, because of which the same strain can infect you after years also. So till now, we haven't heard much about coronavirus, but believe me, it is one of the commonest viruses which causes cold in human beings. If you see, the rhinovirus is one of the commonest one which causes cold. Then the influenza virus, the para-influenza virus, and even coronavirus causes flu. See, people who have come to the hospital or people who are staying at home, they have some common doubts. Doc, why is this virus, or how is this virus causing cold, can be differentiated from other flu caused by other viruses? It's difficult to say, or it's difficult to differentiate majorly between the cold or flu caused by the coronavirus and other viruses. But let's see a chart. Let's see a chart over here. If you see the first one, it is the virus caused, it is the cold caused by the coronavirus, and the cold caused by other viruses other than the influenza. And the last one is the flu. It is caused by the influenza and para-influenza virus. If you see the fever, these are more common in the cold caused by the coronavirus and the influenza virus, less common in the virus in the cold caused by the rhinovirus. So if you see the onset, the flu caused by influenza is abrupt in onset. See, once if you get infected, maybe by a few hours you start getting the symptoms of cold, cough, sneeze, and body pains. But if it is by rhinovirus, then the symptoms start slowly. And the rhinovirus commonly present with, a patient who is having infection with rhinovirus, they commonly present with sneezing, aches and pains, runny and stuffy nose, and sore throat. But these are less common in the cold caused by coronavirus or flu. But what is the most dangerous thing is the shortness of breath, which is not seen in cold caused by rhinovirus or the influenza virus, but which is specifically seen in the cold caused by the coronavirus. And coming to the effects of temperature on the coronavirus, till recently the researchers or scientists said that there is no much effect of temperature on the coronavirus. But as the studies keep coming on, now it has been clearly said that if you see the chart over here, on any surface with a temperature of around 70 to 75 degrees Fahrenheit and with no summer, with no sun, see the half-life, it is around 18 hours, 6 hours, and 1 hour. But the same virus on the surface will not survive for more than 2 minutes if it is in summer and with humidity of 80%. So humidity and the temperature are playing a major role. So these are early studies, but maybe we need more time to get into a action plan for that one. And if you see the aerosols, again, the number of minutes it can live. If you see the half-life with the temperature of 70 to 75 degrees Fahrenheit and with no temperature, it's at around 60 minutes. The same virus will not survive for more than 1.5 minutes. The temperatures are high. So definitely, as per the research till now, humidity and temperature has got effect on the living time of the virus. So origin. So there are discrepancies, and still we are unaware where it has come from. As most people say that it has originated from a viral lab in Wuhan, but the Chinese say that it is originated from the wet market in Wuhan. So we don't know the truth yet. We need to wait for some more time to know the truth. So where are these spread from? So usually the virus is spread from the bats and other animals like camels, cats, and cattle also. So if you go with the history, coronavirus is not new to us, and the virus epidemics are not new to us. If you see in 2013-14, the another strain of virus, which is called as SARS-CoV-1 strain, which has caused MERS in the Middle East countries. It has caused more deaths at that time, but luckily it has restricted to those countries only, UAE countries. But this strain, which is called as SARS-CoV-2, the present COVID-19, it has changed its DNA and RNA patterns or RNA pattern with the genetic shifts or drifts, and it has become more virulent and it's spreading rapidly. The commonest symptoms a patient that can present to the emergency department or to the OPD is fever. As we have seen the chart previously, the commonest symptom will be fever. You'll see a picture of this one. Almost like 80% of population will present to the emergency department or OP with history of fevers. The other common symptom can be a dry cough. The next one is the sore throat, and the next one is sputum production. Remember one point: these are the commonest presentations to the emergency or OPD. That doesn't mean that they may not present with other symptoms. If you see, we have there are people who are presented to the departments, emergency departments, or to the OPD with complaints of body pains, with complaints of loose motions, with complaints of nausea and vomiting, and some of them also presented with shortness of breath, which is more severe. So it's important to know about the common symptoms, but yes, always better to know the abnormal symptoms or the atypical presentation to the departments. But keep an eye or keep an ear to that, so that you can keep a different diagnosis that it can be coronavirus. We've already seen the differences. It's difficult to differentiate, but yes, some may help you out. So risk factors. You see diseases. See, if you think MI or stroke, previously we used to think that it usually affects the elderly age group. If you think of children, they are more affected with mumps, rubella. But coronavirus is one kind of virus which affects every age group. If you see, we have cases, a 3-month-old child has been infected with coronavirus. At the same time, in Italy and France, if you see, there are people who are infected with coronavirus aged about 1 or 6 years. So it can affect any age group people. And the most problematic people are the people who are aged above 65 years. So, and those who are living in nursing homes or in the long-term care facilities. These people are at higher risk. And people who are having comorbidities like high blood pressures, heart disease, lung disease, asthma, kidney disease, these people are at higher risk of getting infected with the coronavirus, and chances of severity being more, and chance of more percent of deaths in these age groups. So these are the age groups, people who should be very careful. Transmission. I'll just read out this point because every word in this one is important. The term transmission refers to the transmission of microorganisms from one infected individual to another uninfected person, either through direct contact, through droplets, or through indirect contact such as surface contamination. See, why I'm concentrating on this one is based on this particular pair of the CDC or WHO or the ICMR has categorized the people or transmission into 4 categories, which we will be seeing in the next few minutes. So how does it spread? So most usually it spreads when a sick person coughs or sneezes, so that the droplets fall as far as 6 feet. So that's why we are advised to stay at least 6 to 8 feet away from any person who is suffering, or to be safer side, always maintain a social distance of 6 to 8 feet. So asymptomatic carriers, these people, yes, we should be very careful with these people, because these people host virus in their body, that is in the nasopharynx and the oropharynx, but luckily they don't present with any symptoms. The unlucky people are those who stay in close contact with them, or when these people, when they cough or sneeze, what happens is their droplets contain the virus, and there is every chance that it will spread into the near and dear or the person who are very close. So the most dangerous people are the asymptomatic carriers. The recent studies shows that these are the people who are being more in number in the recent studies. So the novel coronavirus has 4 stages of transmission as per the definition what we have seen then. So these are the stages. So stage 1 is the first appearance of the disease through people with a travel history. Remember, so initially India got the coronavirus from the people who have traveled from abroad. So it is restricted to them only, and there is no local spread. At this point of time, people who have come from foreign countries only had the disease, and this stage is called as stage 1. And stage 2 is the local transmission. So when a person who has come from abroad, who carries the virus, who has the symptoms, who is positive, transmits his disease to a close friend or a family person, and then we call it as in stage 2. Even then also we can trace the source, and the number of people who are infected will be on the lesser side only. So the most dangerous stages are the stage 3 and stage 4. So coming to stage 3 is community transmission. So even though the government says that there is no stage 3 transmission in India, but I can, or as seen by all of us, we can easily say that it is in community transmission. It is when infection happens in public, we don't know the source, and the source cannot be traced. So what happens is, at this point of time, a large number of people are being infected, and then it spreads rampantly. Coming to stage 4 is when the disease actually becomes an epidemic in a country, with large numbers of infections and a growing number of deaths with no end in sight. It is then considered to be endemic or now prevalent in this region. Luckily, we are not in this stage 4 now, or in most of the countries except for we can consider US, all are in stage 3, and I mean the major countries in the top 10 to 20 are in the stage 3. So how it is spread, or where it is spread from? It is usually by contact of the surfaces. So when a person who is infected or who is positive goes to a coffee shop, sits there, drinks something, he coughs and sneezes over there, and the droplets fall on the glass over there, and after maybe 1 hour, another person comes over there and he sits at the same place, touches with his hand, and with that dirty hand he touches his mouth, then the virus spreads. So the research has been done like on what surfaces the virus can stay and for how long. So they have estimated that on copper the virus stays alive for 4 hours, on cardboard up to 24 hours, on plastic or stainless steel and metals, other metals, it is 2 to 3 days. So we commonly use household items are usually plastic or stainless steel. So we should be very careful in disinfecting these surfaces, because the virus can live for almost 2 to 3 days. On the wood, it can stay up to or live up to 4 days. On glass and ceramic, again up to 5 days. On paper, so there are different strains of coronavirus which can live from only just 1 hour to almost up to 5 days. So getting newspaper into home also is a dangerous thing. So we should be careful about getting newspapers into the house. So that's the reason it's very important to clean the surfaces at regular intervals. Can coronavirus be transmitted through groceries, packages, or food? Luckily, till now, see, I'm just telling the word till now, because as far as the research done till now, it is shown that there is no gross evidence that anyone has gotten COVID-19 from food or food containers. But it can spread through the carriages. I mean, a person who is bringing that one, think that if he is positive and if he has touched the cover, the plastic cover in which the food is bought, and if you have touched that carriage box with the bare hands and touched your face or mouth again, so there is every chance that the food can spread. Only that the evidence shows it has not, or it will not spread from the food, but not from the person who is carrying it. So as soon as someone gets food from outside, try to clean the plastic cover which the person got in, okay, and then safe usage of the food. So how contagious is the coronavirus? Again, these are the early studies. So they say that the transmission rate is very high. So a person who is positive can spread the disease to around 2 to 2.5%. So one study has already found that it is around 4.5 to 6.5%. But the ICMR recently said that one person can spread up to around 400 persons. So we need to have a concrete studies about that one. But remember one point, So coronavirus is very contagious. The only way we can avoid it is by safe methods. So we can lower the transmission by washing hands regularly, keeping the common surfaces clean, limiting contact with other people, and wearing a face mask when we can't stay at least 6 feet away from others. So a diagnosis, it's not an easy task again because different governments are having different rules for the hospitals or the labs. So even though a patient presents to the emergency department or the OPD with a fever, cough, or any symptoms related to COVID, so one has to do testing based on the local protocols. So usually we use the ELISA method or the polymerase chain reaction where we can confirm the presence of the virus. So if you see the chart again, so what I would like to concentrate or tell you about this chart is that remember one thing, uh, the false negativities are the more dangerous ones. You see the RNA by RT-PCR in the first 7 days. A person who is coming to the emergency department with symptoms of COVID and you test them and they found to be negative. So there is 33% chance that a person who is having symptoms but still can be negative and carrying the virus. So it's not like that even by even a test by RNA RT-PCR is 100% confirmative about the presence of disease. At least 67% of the times it can detect that false negativities can occur 33% of the times with RT-PCR. If you see the total antibody test, what we are doing nowadays, the TrueNat test, which is proposed by government to a person who is suffering with all these symptoms come to the emergency department or OPD, and if you do a test, so he will be tested positive only 38% of the times. The other 62% of the times he is tested negative. Again, these are false negatives. So a testing by RT-PCR or by antibody test, beware that there can be false negatives. So if you get a test negative, but you have all the symptoms of the coronavirus, so keep yourself isolated or quarantine yourself for the next 14 days. So where these swabs can be taken from? The best thing is the bronchoalveolar lavage fluid. It is positive 93% of the times, but during these positive times, it's always better to avoid invasive procedures. The best thing is the nasal swab, which gives around 63% the times positive, and the pharyngeal swabs only 32% of the times. So prevention is the best thing because there is no cure yet. How can you prevent it? Wash your hands regularly with soap and water for almost 20 seconds or with an alcohol based sanitizer. So the next most important point is the social distancing. Stay at least 6 feet away from a person who is positive or negative. The next one is the cover your nose and mouth in public. Whenever you are out, carry a mask with you. Let it be a face mask of surgical face mask or and cloth mask. And whenever you are outside and come to home, do not touch your face without washing. Clean and disinfect the areas. Think that you have bought some groceries from outside and placed it on a table. So don't forget to clean the table after dispatching of all the groceries. So clean and disinfect the all the surfaces. So what the commonest disinfectants we use are the 1% sodium hypochlorite or phenolic disinfectants and a sanitizer which contains 70% alcohol. So we can use the 70% alcohol commonly with the metallic surfaces like the door handles of the house or security locks and keys, etc. Whereas the 1% sodium hypochlorite we can use in the shops, on hotels or offices. So what I guess you might have seen these pictures. So always avoid touching the surfaces, doors or knobs with your hand directly. Try to open them with your shoulders or elbow. Few pictures depicting those. So don't try to lean on an elevator. So stand straight and do not touch anything. Wherever you go, it's not only on the elevator, but wherever you go, do not touch anything This is the best way to go in a lift. So we don't know who is positive or who is carrying a virus. A person can sneeze on your face if you're facing face to face with the other person. So always better is to avoid face off. And these are the guidelines given by the ministry. You can follow these guidelines. And treatment, remember guys, there is no specific treatment, as all of you know. There's no specific treatment. So mild cases, think the patient has presented with mild fever, cough, yes, you can treat them symptomatically. And if patient is having severe breathlessness with low saturations, yes, these are the people who has to be hospitalized and treat in hospital. And there is no role of antibiotics. It is caused by virus, so we need to produce antivirals. Antibiotics are only given for the super added infection. So many clinical trials are underway to explore treatments. Okay, so the latest one, or the one which is approved initially, was the hydroxychloroquine and the chloroquine. But again, as you know, there are many side effects related to the cardiac. So some people say that better to avoid those combination and use another one. Now the remdesivir, which was used to fight Ebola virus. Now they are saying that we can use remdesivir, but again there are no concrete studies on this one. So they are trying multiple drugs on trial and error basis. And the other one is the tocilizumab, which is again used to treat autoimmune conditions, but again there is no concrete studies. The one fascinating one now is coming up is the convalescent plasma. The ICMR, WHO, FDA, all are allowing to go ahead with the convalescent plasma. A person, that means, see, convalescent plasma is nothing but a person who has suffered with coronavirus is being treated and found to be negative. So what happens is, in these people, the antibodies are produced, and these are natural antibodies. So taking the natural antibodies from a person who has recovered and injecting them into a person who is presently suffering from coronavirus. So what happens is, as these are natural antibodies, the virus can be killed with the antibodies. So again, the studies are undergoing. We need to know the effectiveness of this convalescent plasma. So vaccine, as you people know, there is no vaccine yet. There are many trials, up to 200 or 100 vaccine projects are going on. Recently, France has said that they have come up with a vaccine. Israel has said that they have come with a vaccine. So there is no concrete base again. So everyone is waiting for that. Maybe by this year end, most probably by this year end, we may have a vaccine. So some safe practice techniques for the medical staff. So, or a non-medical person who is wearing a mask. Remember, a person who is wearing a mask should not touch the mask itself, either the outer side or the inner side. The only thing you should touch is the strings. So wear the mask or remove the mask only with the strings, side strings only. Do not touch the mask directly. Do not wet the mask. Once it is wet, it is useless. A surgical face mask is usually viable up to 6 to 8 hours and not more than that. And an N95 mask is viable in general conditions up to 8 hours, not more than that. But because of the deficiency or sufficient number being not produced all over the world, so what they have discovered is that, or what they have said is that, we can use the N95 mask again and again by following certain protocols. So if you are using an N95 mask today, you can safely keep it aside for 3 days and you can reuse it. So one way we can use a same mask a more number of times, but you cannot wash an N95 mask. So these again are for the medical people. You should be very careful while donning and doffing. Donning is like wearing all the PPE. So the first thing you should wear is the gown, and then the mask or the respirator, and then the goggles or the face shield, and next, the last is the gloves. Please follow this order while you are donning a PPE. First is the gown, next is the mask or a respirator, and the next is the goggles or face shield, and the last one to wear is the gloves. So next is the doffing or the removing of the PPE kit. Please make a point over here. We don't get infected with virus because of dawning, but you get infected with the virus because of an improper doffing techniques or methods. So doffing should be done very carefully. So the first things you need to remove are the gown and the gloves, okay, and then the goggles and the face shield come off next, and the last thing are the mask and respirator. Please follow this protocol. So when you are removing gown and gloves, just strip off the gown, and with the inside of the gown itself, try to remove your gloves also. So dispose this in the specified area, and then remove your goggles or face shield, and then your mask or respirator, and then wash your hands with the alcohol sanitizer. If you think that you can get infected with any of the time during the doffing, so you can wash your hands after each step of the doffing. Think that you have removed your gown and gloves, so you can wash your hands with the sanitizer. Again, before after removing your gloves and then goggles and face shield, you can again wash your hands with the sanitizer. Then again remove your mask or respirator. Again, you can wash your hands. There is no harm in washing your hands regularly. Yes, these are the important communication tips when you are wearing PPE. So no one can hear you completely when you wear PPE, because you will be wearing PPE and the other person also will be wearing in PPE in the ICU. The ICU will be messy, or the emergency department will be messy with people moving around. So whatever you are going to tell, the other person may not be able to hear. You will be asking something to do, and the other person will be doing something else. So it's always better to learn these uh, sign languages with the PPE. They will be useful. Write down your name label on the mask, on the PPE gown, and know the common communication signs. Coming to the recovery rate, again, this is a very early stage to say, but as per the recent studies, the recovery rate will be around 97 to 99.75%. But I guess this will go down gradually as the days pass on or the months pass on. This from the early stages itself. Yes. Can you get coronavirus twice? Yes. This can be because of a reinfection. If you see recently in Vizag itself, we have a patient who was tested positive. He was treated. Then again, they have done 2 corona tests, which came negative. He was sent home, and then later he was tested positive again. So this infection can be because of a reinfection by the virus or new strain of the virus, or because of the virus being dormant, so not even dormant in the patient's nasopharynx or oropharynx and even in the body, and can get reactivated at any point of time. So research is underway, and as of now, we don't know whether it's a reinfection or a virus becoming dominant from a dormant stage. Thank you, guys. If you have any queries, you can ask me. You can type it over there. Yeah, Rajesh. Okay, Anna? You can close, right?